Several stakeholders have gathered at Chiwanga Cell in Goma Division, Mukono Municipality to find solutions to challenges faced by women and girls with psychosocial disabilities. These stakeholders come together as a coalition of different organizations which include My Story, My Initiative, Triumph Uganda, which is a mental health support and recovery program. Also Uganda Mental Health Fellowship, Atanekontola, which develops a social and behaviour change communication and the youth meaningful engagement strategies that supports the dissemination of information regarding the sexual reproductive health and rights among women and girls with psychosocial disabilities.
How do you want them to call us? Tell them how they should call us. But again, much as I understand psychosocial disability, I may not really try to understand it the way a person with a lived experience gets it. So we thought that we would have these people to come on board so that they can now try to explain exactly what they feel. So one idea, yes, we are not seated, we are not keeping documents, but we are trying to groom these members. Number two, not only grooming, but we try to make the rest of the members understand what is entailing in these particular documents. For example, the caretakers. We always have capacity building sessions whereby caretakers also understand, one, how do they support the people that they support.
Dr. Florence Naiga, who is the former State Minister for Disabilities and Older Persons under the Ministry of Gender, says people with mental disorders need to be helped in terms of getting information about health services because they also have a right to reproduction and good health.
People with psychosocial disabilities are not at the same level, different levels of that psychosocial challenge. But much of it is that they are human beings. They should be helped to begin with by the social workers, the medical workers, and government at large, like the police officers. So, but how? They should be able to listen to these who have already come out of it to give the guidance, because they are the experts themselves and they are ready to say, for me, I have a psychosocial problem.
Naiga says many people in our communities and families think people with mental health disorders don't have rights to make their choices, yet they need to be guided using meaningful engagement strategies for them to make right decisions.
If government or the health workers can work with those who have already been empowered enough to be advised on the way forward, that would be good. But where they can't find them, then that's another issue whereby we have to ask these ones to find a way of situating themselves, to locating themselves to positions where they can easily be found. Like they should have those contact telephone numbers which they put out. In case you meet such a person, contact us, so we advise on the way forward. Meanwhile, they have to continue building a team which will understand and be able to guide others who want to give help, instead of really finding them there and you give is it a family planning injection or something, hoping that that will help. Someone may be in his good or her good thoughts, and that one decides to have many children. Those who don't have psychosocial problems, we've seen them. Someone says, for me, I want many children in my life, whether he's earning or not, but will try his level. But for them, if they also, one says, for me, I want children, and for you think, no, you can't have children. Maybe the plan is, if I have my child, that child will care for me when times are hard, when situations change. So my advice is, the organizations formed by persons with psychosocial disabilities should build up a big number of advocates and also continue to talk to the different departments in government and even the NGOs so that they can have a team which can help us in this problem.
The stakeholders agreed that with the issues of sexual reproductive health, health workers have to move out of hospitals and go to the field where they can find women and girls with psychosocial disability and offer them health services.
What have I learned on how to deal with people living with a mental illness in society? One of the things we've learned is we've actually come across is the use of derogative terms, using of very bad language, the use of words such as omulalu or yozonto. I have heard every single one of those words used. Many people calling my brother using such language, and I use that opportunity to educate our community, to raise awareness that despite your disability, your psychosocial disability, you also have rights just like any other person. So I always ensure that we raise awareness in the community on the rights of persons with a psychosocial disability or really living with a mental illness.
They also advocated for proper treatment with dignity for the people with mental disorders when they seek medical services from the health facilities.
But we always encourage people to speak out and ensure that they receive the care that they need. Care does not mean taking medication, but it also means inclusion. How do we include our family members or our friends, our community members in our day-to-day lives? For example, we've seen cases where people lock their family members in the houses the whole day, excluding them. So, these people are living like prisoners in their own homes.
Among the stakeholders who participated in the meeting were health practitioners, policymakers, lawyers, social workers, caregivers, other professionals, and the people who have suffered mental disorders before. Dan Yigamwesigwa, the National Coordinator of My Story Initiative, on behalf of the coalition, says a lot has to be done to ensure that women and girls with mental disorders access sexual reproductive health services.
Inclusion is all over the world now, that we include people. If we are to develop, let us include people in all sectors of life. Like in sexual reproductive health, if there is training in family planning, other things about HIV, AIDS and sexually transmitted diseases, all that should be inclusive. Even these people should be included, and their voice should be listened to, because they have a right to their bodies. We have had problems whereby even parents have decided to take them for permanent sterilization, that they should not produce. After all, they are not going to care for the children, or with such attitudes. We are trying to fight such attitudes that is abusing the right of these girls, because they need they have a right to found a family, and they have a right to choose whom to stay with and to live independently in society.
Mwesigwa said that their rights should not be violated in the process.
So we are calling upon policymakers to emphasize this, and even health workers not to agree on sterilizing girls with social disability, because that is violating the issue of informed consent.
Women who have suffered mental disorders before shared their testimonies and thanked the organizations in the coalition for their endless advocacy for their rights.
I would like to request our government to always emphasize on training different people like stakeholders, community members, family members and caretakers, because they are the ones who live with these people. Then different faculties like police, security, health workers. So me as a person, I would like to emphasize so much on training, because when people are ignorant about the human rights concerning psychosocial disabilities, they end up doing weird things. For example, segregating. You reach at the police when they have raped you, and the police officer tells you, you first sit here for your case, which for your case is just okay. Sometimes when you go to the police, they can first tell you, oyo mulalu nebyaga, like that woman is mad. She doesn't know what to talk about. She's even talking about things which are not connecting.
Truth be told, persons with psychosocial disability, especially young women and girls, we've experienced all kinds of segregation, discrimination, and even decision making that we have not even agreed to make. And so once we talk to our caregivers and tell them, I want this, no, they'll be like, no.
They called upon people in communities and families to help them access services other than isolating them from society.
I've worked with young women also who have psychosocial disabilities, and they tell us, no, my auntie took me for sterilization because she doesn't want me to give birth to children. And others will tell you, actually, I always go to hospital monthly for the family planning because my parents don't want me to have children, which is not right, because us as persons with psychosocial disabilities, we do have rights to have our own children, And so with this meeting, we are hoping that persons, people who are in the community can have a different perception towards us persons with disabilities. Yes, we need supported decision making. It can be my decision, but you also have to support me. You don't have to decide for me all the time because you're not in my shoes, you don't know what I'm going through. And even, let's say, health workers together with the people who are into policy making should also reach out to us and ask for, get to know from our side before they make a decision, because they may make a decision based on what they think they know, which is not right.